Good morning, everyone. I'm Catherine Brookman, Associate Director, Knowledge Transfer and Exchange, and on behalf of Dr. Jack Callahan, Director of the Center of Research Expertise for the Prevention of Musculoskeletal Disorders, or CRE-MSD as we are more commonly known, we'd like to thank you for joining us today for this free webinar, Transitioning Out of the Pandemic, Expected Work Environment Challenges and Opportunities in a Hybrid Work Era. This is the fifth webinar in a series of 5 webinars on supporting remote office work, pivoting back to the workplace during a pandemic and the future of workspaces. We'd like to acknowledge and thank our health and safety system partners who have supported and collaborated with us on this series. Public Services Health and Safety Association, Patricia Clausen, Structure Health and Safety Association, Peter Guy.
Sorry, Catherine, to interrupt. Sorry, we're having some troubles with your audio. Maybe we could just have you put your headset on and see if that might be any better.
All right, let's try that. Right, I have my headset on. How is this?
Okay, it's clearer. If you could maybe just increase your volume a little bit, and then continue, yeah.
Okay. So I believe we left off thanking Workplace Safety and Prevention Services Don Patton and Andrew Flanagan from Occupational Health Clinics of Ontario. Just would like to double check with you, Bettina, that you can hear me all right?
Yes, you're not cutting in and out anymore. Thank you.
Okay, very sorry about that to all our participants. We are grateful to the Ministry of Labor, Training and Skills Development for our funding, which supports the delivery of these webinars, and of course to our presenters who provide their expertise. We ask that you keep yourself muted for the duration of the webinar as a courtesy to the presenters and all participants. During the question and answer period, we ask that you type your questions into the chat box. The chat box can be pulled up on your screen by selecting the chat icon in the control panel that appears near the bottom of your screen. I will relay these questions to the presenter or a similar question should we have duplicate themes. Should you have a pressing question or an issue such as a technology glitch that cannot wait until the end of the presentation, please type this into the chat box and we will do our best to address it right away. The format of today's webinar is as follows. The presentation will be given, after which time we will have 10 to 15 minutes for a question and answer period with Maral, our presenter. The webinar will be recorded, with the recording being made available to you on our website, along with the presenter slides shortly after today's webinar. After today's webinar, you will also be sent a link to an evaluation. Please fill out this evaluation as it will assist us in the future delivery and planning of our webinars. We'd like to thank you for joining us today and encourage you to watch the CRE-MSD website and the MSD prevention site for new resources and events. Now it is my pleasure to introduce to you our presenter, Maral Babapour, who is a design and human factors researcher at the Institute of Stress Medicine at Region Västra Götaland in Sweden. She is also affiliated with the profile area of Healthy Work Systems and Ergonomics at Chalmers University of Technology. Maral's research primarily applies a user-centered design methodology to study the complex, multidimensional relationships between people and technical systems. One of Maral's major interests is to understand how new workplace solutions covering new products, services, systems, ways of working, or environments are adopted in everyday work life. Her current projects are focused on activity-based flexible offices, hybrid and remote work, and using virtual reality for knowledge work. Now over to you, Maral, and thank you for your patience with this.
Thank you, Catherine. I'm just gonna check how my voice is doing.
That sounds excellent.
It's
Thanks,
good.
Maral.
Thank you. First, I would like to welcome all the 112 participants who are tuning in today to listen to this seminar. I am grateful for having been given the opportunity to present tentative results from an ongoing project with you today. So what I will be talking about is on this transition from the remote work change that a lot of employees experienced during the pandemic because of the restrictions. And I will present the expected work environment challenges and opportunities of a hybrid work era. As Catherine introduced me, my name is Maral Babapour. I am a researcher at the Institute of Stress Medicine, which is a part of part of our public sector that provides healthcare services to our municipality. So it's a publicly funded research institute, and our tasks are to conduct research on work environment and work-related stress aspects and give recommendations for practice. Since we don't have a video on this seminar, I put up a picture so you kind of, if you see me running down in the street all the way from Gothenburg in the west coast of Sweden, you could recognize. I have a background in industrial design engineering with the human factors specialization. I did my PhD in a field called human technology design and wrote about adoption of flexible and activity-based work environments. I worked as a researcher at Chalmers from 2010 to 2019 and did a lot of research on different types of work environments. Everything from vehicle ergonomics to child seat safety, and sometimes it was not just work environment, but also consumer technology as child seat safety aspects. And in the past 2 years have been at the Institute of Stress Medicine. This project that I'm going to talk about is nested in an ongoing project that started in 2017. And it was about evaluating activity-based working from the beginning. We were, oh, I hope the audio is working. Can you confirm, Bettina?
Yes, yeah, we can hear you just fine, Maral.
All right. We were evaluating a case of relocation to activity-based flexible offices where employees are moving from different kinds of environments to an environment that is mostly open and has a clean desk or free seating arrangement. This was three different office buildings and involved about 3,000 employees that had relocated in 2018 or 19 in the different buildings. And the purpose was to evaluate the consequences from a work environment perspective and their perceived health and productivity. And we do this research in an interactive way. So once we had collected data, the baseline surveys and the follow-up surveys and the focus group interviews, after each round of data collection, we would summarize and give kind of an overview of preliminary results to the practitioners who work there. And would give recommendations based on our findings. And this interactivity by the beginning of the pandemic meant that when we presented our results, we were given new research questions, and those were about, are these findings that we have about improvements in the office environments, will they be relevant after the pandemic? What will be employees' preferred ways of working, and what are the expected needs, and how can we tackle the future work after the restrictions? So with these new research questions, we kind of had to cancel our planned last survey. We had hoped to do a survey 18 months after their relocation, but since it was in the middle of restrictions, we canceled that and instead did a mini survey, a very, very short survey to kind of measure the temperature. How do employees in this context prefer to work? How were they working during the pandemic, and how would they want to work afterwards? And then in addition to that, we did a series of focus groups, specifically 9 sessions with 61 participants, to map future scenarios and identify what they expected or perceived as challenges and demands. These data collection rounds were in spring 2021. Which is just 9 months ago, about 9 months ago, and it's also good to highlight that in Sweden we never really had a strict restriction. Rather, employers were given some flexibility in choosing their restrictions. And this specific organization recommended their administrative staff to work from home if possible. If they could not do that, they could go to the office and work at the offices. So it's good to have this context in the background. And the case is an administrative context in a public service environment. These are administrative employees that support the public sector with healthcare services, transport, regional development, and cultural development and tourism. That's west of Sweden. Prior to COVID, they had very limited remote working. And even though they had implemented this flexible office arrangements, it was somewhat frowned upon, as we learned during our data collection. It's also good to know that they did have video conferencing tools before the pandemic, but these weren't used to a large extent, only among teams that were kind of distributed in the region. And they implemented Microsoft Teams in October 2020. So this transition to remote work was for them a huge technical transition as well as the remote work, which is not the case in many other organizations that have a lot of digitalization, that had a lot of digitalization going on before the restrictions. And it's also good to know that the restrictions were more more restricted since November 2020 and more open before that. So there had been some changes in how much work from home was allowed and expected. So I'm going to present the results from these workshops because that's where we got the most insights. And they were set up so that we had participants representing different roles. They were employees, managers, or work environment representatives. We also had a couple of service and facility experts and ergonomics from their occupational health services, just to capture these different perspectives. And we asked them to simulate, to think about how a fictitious work week would look like after the removal of the restrictions. And based on that simulation of a work week, they were asked questions about what benefits and drawbacks they see with respect to the physical work environment, digital work environment, social and organizational aspects. We used these digital whiteboards to facilitate these workshops, and recorded the material and basically treated them as focus group interviews. So they were transcribed and analyzed afterwards. And once we had also analyzed, we presented these results for different groups of managers because they had not yet chosen a strategy for their future remote work policy. Before the pandemic, as I said, they had very restricted remote work policy, but they wanted input to be able to formulate new routines and guidelines for it. Before I present the results, this was a process for me as a researcher to learn about remote work. This wasn't something that I had read a lot about. And I'm going to just give you a quick snapshot of what research says about remote work before that a lot of research has been done on remote work, but before the pandemic. And it's good to remember that this was a vision. It was possible since the 90s, and it the way it became widespread in the past year was a vision that many had for the 20s or 2020s or 2030s. There has been a lot of research from different perspectives, environmental and traffic perspective or gender perspective, but this research that I'm citing now is a literature review from a kind of more occupational health and work environment perspective. And most of the studies that these authors have reviewed show that remote work, which was introduced and done before the pandemic, leads to better work-life balance. It increases engagement and job satisfaction among employees. And this is partly attributed to the increased autonomy, and that in general people report take less sick leave days, but there is a risk for sick presence, as this decreased sick leave could be due to the fact that people just work a bit even if they are sick at home. The studies about performance show either unchanged or increased performance, something between 0 to 14% increase, and this is usually measured either as perceived or as objective performance, depending on the studies. Some studies that are done in for instance, sales contexts can more easily measure objective performance outcomes than others. The risks that these studies highlight is social and professional isolation. And this is something that the researchers say in the context of remote work before the pandemic, that was initial, because when organizations would do this, it was usually in the form of an intervention And once they tested and realized that this isolation is an issue, they would introduce forums and networking activities to address this issue. So it wasn't something that they saw as permanent. Another challenge was that researchers highlight is the difficulties in both creating and keeping boundary setting strategies, and that can go both ways. Something private life can move into work life and vice versa, and that's something that previous research highlights as a challenge. There has been quite several studies published about remote work during these past 2 years. And what we can say about these studies is that they show a polarized perspective and a kind of show that the work conditions of employees has been polarized. And I'm now talking mainly, or actually only, about employees who have some sort of an office job, either knowledge workers or administrative workers, not those who work in service industries. So this polarization is about office workers, basically, and there is even a larger polarization if you look at office workers versus service workers who, for instance, healthcare workers who have had to be in the front line in the past 2 years. So these studies show, as previous studies, the remote work has led to work-life balance, that people appreciate that having fewer distractions, and they don't have this misspent time on commuting or on office household chores that are done in offices. And they appreciate increased control or autonomy, and experience that their both individual and group performance have improved or become more efficient. But the work conditions seem to be, as I said, polarized. For some, it also depends on their household limitations, the family condition they have, the home offices they have. And for some, it also meant increased work hours. So the time that they save from not commuting has not necessarily meant more time for leisure or more free time, as I said. The increased digital tools also have implied an amount of cognitive overload, as the digital interaction for a lot of employees require more demands on interpreting social cues and dealing with IT challenges. And like previous studies, challenges with blurred work-life boundaries and social and professional isolation are reported in these studies that have been going on. And we also saw that in our data. And this is something that was emphasized on not just because of the remote work, but also because of these restrictions and the social distancing of that the pandemic period implied and imposed on a lot of people. So this isolation was not really initial, rather it has been going on for 2 years for many. Some studies that have been published say a report about 50% in increased performance and fewer work hours. And this is this polarization that I talk about. Half of this study is a really large survey studies, and they show that they really emphasize on this polarization. Another survey study shows that people with roles that are more interdependent, that need a lot of feedback, either giving or receiving, are less positive about remote work. I also want to highlight 2 Swedish studies that focus more on physical activity and sleeping time and posture variation. One of the studies that followed 24 employees for a period of 2 weeks. These employees had a bit of a mixed work. So some days they were at the office, some days they were at working from home. And the data showed no difference in physical activity, but they found in average 34 minutes more sleep time, which is a very important gain from a public health perspective. The other study had a more or less similar setup. They found more postural variability when people work from home and more heart rate variability. And the heart rate variability is an indication of how relaxed people are. Nonetheless, the last study highlights that the risk of the general sedentary work, it wasn't necessarily that people were more physically active than working from home. It was still quite sedentary, but there was some more variation at home. Now I'm going to move on to the challenges and opportunities that we identified. The scenarios that we saw that our participants talked about there were 3 concrete scenarios. Some of them talked about how they would fully return to the office after the restrictions. Some of them envisioned that they would continue to work remotely, more or less full time, and others talked about this hybrid format, some days at the office and some days remotely. And I'm going to focus on this last scenario because it has the challenges and opportunities from the previous scenarios and some more. Also, you see that it's about 35% that see this last scenario, that saw this last scenario as what would happen after the restrictions. And in Sweden, since 30th of September, the restrictions have been removed. So some of these scenarios are actually now not anymore scenarios. They are everyday work life now. So what is hybridity in hybrid work? It's a word that is being used in so many contexts, and I just try to first pause and talk about what it means, how our participant talked about it, what does it imply when it comes to everyday work life. Some talked about 50-50 for everyone, 2-3 days a week at the office. And the way this would be implemented was seen in very different ways. Some talked about having fixed days at offices so everyone could meet. Some talked about having rotating schedules so they wouldn't crowd the offices every other week or so, with others, so that they wouldn't, not the whole organization would be at the premises. And some prefer to have it flexible, not steered in any way. Then there were those employees who had a bit more zoomed out perspective and saw this hybridity as a mix of full-time office workers, full-time remote workers, and this 50-50 combination. And this could be either preference dependent or task dependent. And what all of these different formats have in common and require is hybrid collaborations, which you could define as a combination of synchronized, asynchronized, co-located, and distributed interactions over a longer period of time. It could be either projects or collaborations in a work group that doesn't have a start and end. And asynchronized communication is something that everyone have been dealing with, but this combination and potentially increased asynchronized communication is something that this new format may require. The other thing in these collaborations is the so-called hybrid meetings, which is a synchronized interaction between co-located and distributed participants, which hopefully and usually is time limited. So this is what we saw as the hybridity on different levels, on a very kind of scheduling high level, but also on a macro, on a meso and micro level, on a meeting level, and long-term collaborations. And our participants saw different challenges and opportunities with this. First, the possibility to have customized work arrangement, that they saw this normal work life where everyone went to the office every day would not be something that they would do and they would see in the future. And this was something that we saw both among the managers and the staff who participated. We also talked about keeping the increased autonomy that they had kind of gained during the pandemic, and really appreciate the developing their self-leadership skills, and so that this gives satisfaction and more kind of quality time for their family and children and pets, or space to be more physically active. It also gave them more being able to have hybrid work. They saw that it gives them access to more variation and services, something that they missed from the pandemic. Just going to an office and eating lunch at a restaurant was something that they really looked forward to. And at last, keeping this work-life balance and being able to pursue physical activities or other hobbies that they felt they had more time for. So these were kind of positive aspects of having a hybrid work format from an individual perspective. Also talked a lot about communication and interactions, and this is a topic that was I would say biggest topic in all of our scenarios. An advantage that they saw was combining different types of meetings, and this was having spontaneous interactions, having more structured online meetings as they experienced that in their online meetings. They cut the crap and really get to it, but they felt that this has a bit of a stress. You just want to get to the point, and then they lost during the pandemic this deeper discussions or creative activities with their colleagues. So they talked about the ability to having the best of both worlds. And building, they felt that they were losing their community. So this building back their community and just meeting for play and fun instead of focusing on this individual productivity was something that they saw possible with this hybrid work. And this is something that I think is perhaps also because of the lack of social activities during the pandemic. And something that they had adopted was taking work outdoors, and they wish to continue doing that. We're talking about how their offices were placed in a way that might not be convenient to go for a walk and talk, or have access to a park for listening to a seminar or something like that. So they felt that they could even use the public spaces in the city in a different way than they had before. All of these combinations, they also saw risks with it, and the risk was this increased asynchronized communication, and feeling that they will continue to have to be available all the time and get all of these notifications. While at the same time they refrained from asking help, and they felt that if this mixing or this hybrid format, if it is unstructured, if they don't get to meet their colleagues when they are at the office, would mean that they would get less social support. The combination of these different types of meetings that they saw as a benefit would also require a lot more planning, coordination, and synchronizing, and making sure that people don't miss perhaps decisions that are taken on the way to a meeting, or to a meeting room, or at a coffee break. And this is something that they felt that they had to work and develop to make sure that they include those who are working from home. And apart from the way to and from meeting rooms, just achieving inclusivity in hybrid meetings was something that they talked a lot about, and that the technology of today doesn't really allow for having inclusive hybrid meetings, and that they felt that they will have to all connect from their own devices to be represented in equally. And this would also create a bit of frustrations and frictions, because if they would go to the office to meet, they wouldn't want to be forced to sit in front of their computers and have digital meetings. Those who had distributed teams, some of these participants worked from different cities, so they felt that it is better for them to work remotely and sometimes meet up. They also talked a lot about those who were located in the same offices. They talked about this fear of missing out, and potentially creating groupings, those who want to be at the office versus those who are away, and how to address that. They didn't really have solutions for it, but these were potential challenges they lifted. And it also involved not just within group splitting, but also kind of having contact with the rest of the organization, and the risk of ending up working with your own immediate colleagues and just operating in information silos was something that they worried about, and that this would reduce this sense of belonging that they had to their organization. And they felt that it could lose this belongingness. There were also several findings. This was something that both managers and employees participating and this was something that was they didn't quite find a satisfying solution. They felt that they have the managers had to fulfill their work environment responsibilities, but at the same time, it felt like it's difficult to read the social cues, those subtle signals on Zoom or Teams, and really get to know how people are. Someone mentioned no one smells like booze in a digital meeting. And this, when they try to kind of have an eye on how their employees were doing, both in terms of performance and how well they were, it was sometimes perceived as having a control-based leadership. So they always felt that they were kind of having a challenge in finding a balance between trust-based leadership and at the same time making sure that everyone were all right and were receiving support for achieving their goals. There were also talks about conflicts and ambiguities, that people will end up comparing how different work groups end up being flexible depending on how managers allow for flexibility when returning. And then the managers also felt towards the organization that it could, if they have a lot of employees that work remotely, the costs that they pay for facilities the cost model was not something they quite liked, because they felt that they could use that money for something else for their development of their group. They felt definitely that they didn't get support to develop these aspects that they were being challenged in. We found a lot of challenges with respect to physical work environments, but also the fact that people really looked forward to getting back to the offices because they saw that as better ergonomics that provided better ergonomics. Since this is a public sector, they didn't have a lot of resources to provide ergonomic equipment at home. And it's also quite interesting because they had these flexible offices. They didn't, and before the pandemic, when we did our surveys and interviews, they really disliked those flexible offices and how uncomfortable it was to adjust and adjust their seats. So their mindset and perspective about these offices had changed quite a lot because they had to work from home for a long time. I also felt that returning to offices will imply having to deal with distractions and crowding on site, and that their offices weren't really set up for having a lot of online meetings, that they felt that it was quite challenging to find small rooms for these meetings even before the pandemic. And that the meeting rooms didn't have technology for this inclusive hybrid meetings that I mentioned. They will have to continue dealing with increased cognitive demands of online meetings, no matter how they would, what scenario they attributed their work to be. They also had a lot of worries for infection risks, and not just from COVID-19, but also they saw that they had to develop better routines to avoid getting these winter sicknesses that everyone gets. A lot of people get in the winter here. And since this is an office with clean desking, they saw that returning to the office would require first developing new routines, handling commuting time, but also in the office they would feel that they would be inefficient, at least not as efficient as they had been at home. I'm gonna scroll forward to my conclusion page here. Just to summarize, this remote work before the pandemic was for these participants kind of stigmatized benefits. Some people were allowed to, depending on their managers, some not. During the pandemic, for them, it became a norm, and also on a general level in the society. And for some, it's perceived as a partially removed benefit or even decreased freedom. And their preferences for how they want to work differed a lot. They have different households, they have different individual competencies and preferences. They also have different social climates within their groups, and some are geographically distributed, some not. And of course, they have different tasks and levels of interdependencies. So, and these different aspects form their preferences. And the managers have experienced challenges dealing with these preferences. They will have to continue dealing with these conflicts. It's something that out a lot, but also challenges with resource allocation and why they don't get resources for improving their home offices, or why don't they get to pay less rent for their offices. These are kind of aspects that both managers and employees are dealing with as we talk. There is a lot of knowledge gaps in this concerning this aspect. And since I have sustainability interests, there is in Sweden a lot of incentives for organizations to choose policies that contribute to sustainable development. And that's something that they have to develop and think about when they pick their policy. And they ask us a lot of questions. Does the extent of remote work matter in this hybrid setting? How do we make trade-offs? And what we collected now was their expected work environment challenges. What will be their actual challenges that they are experiencing now and in the long term? And what kind of support do managers and groups need to be able to figure out a good trade-off between individual and group organizational performance, and how they can develop support and services to make hybrid work for them. I want to thank you all for paying attention, and would like to ask Catherine to join in if she has questions for a short Q&A.
Yes, thank you so much, Maral, for that excellent presentation. And I'm sure we all saw a lot of similarities between what we are experiencing ourselves here in Ontario and across Canada for others who have joined us outside of Ontario. We have some questions that have come up, so I will jump to those. And the first one is related to early on in your presentation when you discussed the findings from your research. Did you segment out your findings for those who were working from home generally, and then those who were working from home with children and other caregiving responsibilities?
No, that's a very good question. We didn't segment. No, we didn't actually include that in our questions, but it did pop up in our surveys. And it's as I mentioned, this was nested in an existing project, and it was a bit of a challenge when you have, it is a bit of challenge when you have this interactive research projects, because you can't always ask everyone everything you want to ask, so you'll have to make compromises. But there are studies that look at this. I can copy a couple of references at the end of my presentation to that answer, that hopefully answer to your question.
That would be wonderful. And even if you, when you send us your PDF, if you send us those potential references, so that would be great
Yes.
for our participants to have a look at. When you were talking about the sleep time results, the approximately 34 minutes increase, was that for individuals working both from home and office environment, or just for those working 100% from home?
That was done. The participants in that study, they worked, I think it was almost every other day or half of the work week at the office, and the rest from home. So they measured the difference between office days and home days on an individual level, and then they compared on the group level.
Okay.
Did that
Yes.
answer your question?
Yes. Yes, it did. Thank you very much for that. And you also talked about inclusivity in hybrid meetings as being one of the challenges. And we're wondering if you had any feedback about suggestions when people gave comments. Did they ever talk about what that inclusivity could be?
That's a very good question. It's the comments were, I just give a couple of pointers without having tested them myself. So I don't know how how well they work in practice. But one of the comments was that the meeting participants who are at an office, it would be beneficial if you're in a meeting room, if you all connect through your laptops, because then you're being shown in an equal term as well as the remote participants are being shown. So that is one thing that they talked about or suggested. And the other was also really making sure that the structure and the way meetings are documented and agendas are sent out is clear. And if you end up continuing the discussion, you will add it to the meeting minutes so people are not left out. And just, making sure that you don't end up speaking to or whispering to your neighbor in the meeting room. Rather, the meeting facilitator having this role of asking people to speak up instead of talking to each other, so everyone is included. Another good example was to, depending on the meetings, if you were to be divided in groups to discuss something, instead of having the office team and the remote team discussing separately, getting people to be one office worker and one remote worker and discussing together and then gathering together. So these were the kind of bullet points that I have about yeah, at least trying to be more inclusive.
Thank you. That's extremely helpful. One of our participants is wondering about, for those employers who did provide office equipment, was there any comparison for those who didn't get office equipment?
That would be a very nice study to do. This case that I talked about, they did not receive any office equipment. They did receive ergonomic support, kind of from the perspective of frugal ergonomics, where they got kind of help. They got to talk with ergonomists. They made these short films about how to raise their screens, or how to put a cushion behind their hard surface chairs, and that kind of support they received. But I think it will be definitely worth conducting a study to compare the physical ergonomics of this different levels of support. And it's also just to remember, musculoskeletal disorders is not something that's developed in a short period of time, rather over a longer time. So we probably won't see disorders this soon, but I think we are in a phase that we will be seeing a debt, a kind of ergonomics debt that we will have to pay on a societal level.
Thank you. Thank you for that. And that was certainly one of the questions related to MSDs, the challenges. If we saw, or if you saw any neck pain or back pain from the participants.
Um, if this is a bit paradoxical, because some of the participants talked about how they don't have pains. So they talked about how much like they have more time, they get to go for a walk now when they work from home, but at their offices that is in the middle of the city, it's never pleasant to take a walk. And these physical activities that they've, like these routines that they've fixed, help them, I guess, compensate for their poor ergonomics. And then there were also some who mentioned that they have pain necks, but I don't think I saw a trend. I just mentioning that there were these paradoxes, and we saw both of them.
Thank you. That's very helpful, especially for us at CRE-MSD to hear that. Was there any gender-based analysis within your data?
No, it's. I want to highlight that since this is public service sector, it's about 65% women being employed in this organization. We did have this kind of, this was portrayed in our participants, but we didn't do an analysis. I will add a couple more references from a gender perspective, because I just read a couple of papers that have done such analysis to the reading page at the end of my presentation.
Oh, thank you so much. We also have an interesting question here, I think very much related to the inclusivity piece, and that is, did you find that were your results suggesting people were more courteous in video remote meetings? Did you hear or see anything related to that?
I think definitely there were people were more courteous, and they also talked about how seeing someone at home with everything that goes in the background makes kind of have made improve their relationships. They could relate to their colleagues in a better way. They were more patient with IT glitches, and also through time they learned. I told you about MS Teams being implemented in October last year. and it took a couple of months for them to, as they talk, to learn how to interact with each other in these formats. They also learned about each other's preferences. So some people talked about, oh, I know this colleague, he prefers phone calls, so I just take a walk and talk phone call meeting with him when I need to discuss, and if it requires, great. So I think they definitely were kinder. But this is a very, as I said, this is very, this is my interpretation of what they talked about and what I presented. I also want to emphasize that these are preliminary results. They haven't been published and peer reviewed, so take it with a pinch of salt.
Oh, thank you so much. We are actually out of time and we still have a couple of questions. So I will make sure that you get those questions and you have the opportunity to respond to those questions. And I just want to thank you for just a wonderful presentation. You've given us a lot of food for thought, and to thank our participants today, to encourage them to watch for our future CRE-MSD events and our MSD prevention guideline news, and to let everyone know that we at CRE-MSD and our health and safety system partners have a survey coming out on transitioning back to office work, and you will hear more about that. So thank you and have a great rest of the day, everyone. Thank you again, Maral.